He seized her by the collar and slammed her into the wall so hard the supply tray crashed to the floor. "Get your hands off me!" The SEAL's voice was pure ice, blood pouring down his chest, jaw locked, eyes burning with the kind of rage that had nothing to do with pain. He pointed one finger directly at her face. "You, get out. Send me somebody who has actually earned the right to touch me, not a nurse who has never seen a real battlefield in her life." Every person in Trauma Bay 3 froze. Clare Merritt peeled herself off the wall, straightened her scrubs, and looked at the man who had just thrown her like she weighed nothing. She did not leave. If you are new here, please subscribe to our channel and follow this story all the way to the end, because I promise you, you will not see this coming. And drop a comment below telling me what city you are watching from. I want to see how far this story travels. The night had already been long before the helicopter landed. Bay 3 at Northeastern Regional Medical Center had seen 3 cardiac arrests, a multi-vehicle accident, and a teenager with a kitchen knife wound before the clock even reached 11. The staff moved through the corridors with the particular exhaustion of people who had learned to keep functioning past the point where normal human beings would have sat down and wept. They had learned to compress their feelings into something small and dense and push it somewhere behind their sternum, where it would wait until after the shift, or after the weekend, or after retirement, whichever came first. Clare Merritt had been on shift for 14 hours. She did not look like someone who had been on shift for 14 hours. She looked, if anything, like someone who had just arrived. Her movements were precise and unhurried. Her eyes tracked everything in the room without appearing to look at anything in particular. One of the younger residents, Dr. Paul Eggers, had once told a colleague that watching Clare work was like watching someone play chess, while everyone else around her was playing checkers. He had not meant it entirely as a compliment, but Clare had not heard him say it, and even if she had, she would not have cared. She was 47 years old, brown-haired, medium height, with the kind of face that people described later as calm, and the kind of hands that never, ever shook. The call came through at 11:14. Military transport, 3 casualties, 1 critical, ETA 4 minutes. Clare was already moving before the announcement finished. She pulled on her gloves, checked the supply tray, mentally cataloged what was stocked and what needed to be restocked. She signaled to Maya, the charge nurse on duty, to prep the second bay as overflow. She did all of this without raising her voice or breaking stride. "Clare," Dr. Eggers fell into step beside her, clipboard in hand, that particular expression on his face that meant he was about to say something he thought was helpful, and was not. "The incoming, they're saying military special operations. There might be, the hospital administrator wants to make sure we have senior trauma staff on this one." "I'm senior trauma staff," Clare said. "I know that, obviously, but..." "Dr. Eggers." She stopped walking and turned to look at him with absolute patience. "What is it you actually want to say?" He opened his mouth, closed it, looked at his clipboard. "Nothing, you're right." She turned and kept walking. The helicopter had already landed by the time she reached the bay doors. The medic who came in with the transport was young, 25 maybe, with that particular 1,000-yard intensity that field medics carried. He was talking fast, rattling off vitals and injury assessment with the efficiency of someone who had done it 100 times and knew that every second of transition was a second that mattered. "GSW to the left shoulder, through and through, looks clean. Shrapnel fragmentation, left thoracic region, 3 confirmed, possibly more. Blast concussion, moderate to severe. BP has been dropping. Lost consciousness twice in transport. Came back both times on his own. He's been..." The medic hesitated for just a fraction of a second. "Combative." "Combative how?" Clare asked without looking up from the chart. "Physically combative. He pulled out his first IV, through a monitor. He's been trained to resist, ma'am. That's all I can tell you." "What's his name?" Another fractional hesitation. He hasn't given it. The rest of his team calls him Hawk. Claire nodded once, filed that away, and pushed through the bay doors. The man on the gurney was big. That was the first thing anyone would notice. Even injured, even bleeding, even stripped of whatever gear and authority he normally carried, he took up space in a way that most people did not. He had the build of someone who had spent a decade making his body into a specific kind of tool, and the expression of someone who had never once been in a room where he was not the most dangerous person present. Until tonight, apparently. His eyes found Claire the moment she stepped into the bay. They were sharp, those eyes. Alert in a way that his vital signs did not entirely support. Pain did not dull them. If anything, it seemed to make them sharper. "Who are you?" he said. "I'm your nurse tonight," Claire said. She stepped beside the gurney, picked up the IV line, found his vein with the practiced ease of someone who had done it in conditions considerably worse than a well-lit trauma bay. "My name is Claire. I'm going to need you to stay still for—" He grabbed her wrist. Not gently. The grip was the grip of a man who had been trained to restrain people, fast and locked and deliberate. Claire did not cry out. She looked down at his hand on her wrist, then looked up at his face. "I said," he repeated, his voice carrying the particular weight of a man who was accustomed to giving orders and having them followed without question. "Who are you? And I mean, who are you? Not your name. What are your qualifications? Because I have a team out there, and I need someone who knows what they're doing in here, not someone who—" He looked her over again in that way he had, assessing, dismissing. "Get me a doctor," he said. "A senior one, not a floor nurse." There was a sound in the room, not quite a gasp, more like a collective intake of breath that people tried to disguise as something else. Somebody's pen clicked. A monitor beeped. Claire looked at him for one long, unhurried moment. Then she gently but firmly removed his hand from her wrist. "You can have a doctor," she said. "And Dr. Eggers is right outside that door, and he will come in here and he will do exactly what I tell him to do, because that is how this bay runs. Or you can let me work. Your choice. But I need you to make it in the next 30 seconds, because your blood pressure is dropping and we don't have the time for the longer version of this conversation." The room was very still. Hawk stared at her. "You've got 30 seconds, Claire said, turning to the supply tray. "I'm going to start using them, whether you've decided or not." Nobody in Trauma Bay 3 breathed. It was Maya who moved first, sliding to the other side of the gurney with Claire's next supply request already in hand, anticipating without being asked, a habit she had developed after 18 months of working alongside Claire, where anticipating was the only way to keep up. She caught the eye of the respiratory tech standing by the door and gave the small nod that meant, "Stay ready." Hawk had not answered, but he also had not shouted for a doctor. Claire worked. She worked the way she always worked, which was the way a person worked when they had long since stopped needing to perform competence and simply exercised it. The way a musician plays an instrument they have played for so long that the instrument feels like an extension of thought rather than a physical object. She read his vitals with a glance. She assessed the shrapnel wounds by touch, her fingers moving across the left side of his chest with a pressure that was firm enough to be meaningful and controlled enough not to cause additional trauma. She noted the way he was breathing, slightly shallow, slightly compensated, which meant the lung had not been compromised yet, but the threat was real. 3 fragments visible on imaging, she said, mostly to Maya, but loud enough that Hawk could hear. 3rd one is the concern. We need a chest x-ray in the next 10 minutes, and I want Dr. Reyes in here, not Eggers. Reyes has hands for this. Reyes is in Bay 1, Maya said. Then let's hope Bay 1 wraps up. Claire pressed 2 fingers against Hawk's ribs, watching his face. Does that hurt? Everything hurts, he said. I need a more specific answer. His jaw tightened. For a moment, she thought he would refuse to cooperate out of sheer stubbornness. Then, sharp, left side, Gets worse when I breathe deep. Good. That's useful. Thank you. She was already adjusting her assessment. Don't breathe deep. I wasn't planning to. Sarcasm is a good sign, she said. It means your brain is working. Something crossed his face, not quite a smile, but not hostility either. Then his vitals monitor alarmed. The sound was the particular pitch that meant the number had crossed a threshold that mattered, and it pulled the room's attention the way a fire alarm pulls attention. Automatic, total, immediate. Claire's eyes went to the screen, back to Hawk, and she was already moving. BP's dropping. He's compensating less than he was. Maya, I need... Already pulling it, Maya said. Good. Get me a second line in, left arm, and I want a surgical consult standing by because I think that third fragment is closer to the pleural space than the initial read suggested. And if it shifts... I'm fine, Hawk said. His voice was still controlled, still that low, authoritative register. But there was something underneath it now, something that Claire heard and cataloged without making a show of having heard it. Not fear, exactly, something adjacent to it. The specific tension of a person who is very good at handling external threats and very unaccustomed to threats that come from inside their own body. I know you are, Claire said, with a tone that was matter-of-fact and not unkind. I'm going to keep you that way. So right now I need you to stop fighting the process and let me work. I don't. He stopped. He looked at the ceiling. A muscle moved in his jaw. I have men out there. My team. 3 of them came in with me. Where are they? I need to know their... Your team is in bays 1 and 2, Claire said. They're being taken care of. I need you to be in bay 3 with me, right now. Silence. Then, are they bad? It was not quite a question. It was the voice of a man who had asked versions of that question before and had not always gotten answers he wanted. Claire paused for a fraction of a second, not out of hesitation, out of the particular respect she had learned to give to moments like this one, where a person asks something that matters more than their injuries. 2 of them are stable, she said. The third, I don't have information on the third yet. What I know is that the people working on your team right now are good at their jobs, the same way I'm good at mine. So the best thing you can do for them right now is stay alive and let me work. Hawk closed his eyes. When he opened them again, something had shifted. The combativeness was still there, underlying everything like bedrock, but it was no longer pointed at her. It had reorganized itself into something she recognized. The controlled stillness of a person choosing to stand down because the tactical situation demanded it, not because they had been defeated. Fine, he said. Thank you, Claire said. She went back to work. The next 20 minutes were the particular kind of demanding that she had learned to find clarifying rather than overwhelming. The third fragment was exactly where she had suspected, closer to the pleural space than anyone had initially read, sitting at an angle that made it a time-sensitive problem rather than a wait-and-see problem. She had Rhea's page twice before he appeared, and when he looked at the imaging she had already pulled up, she watched him do the same rapid recalculation she had done and arrive at the same conclusion. You caught that fast, he said. It was there to catch. He looked at her sideways, the way doctors sometimes looked at Claire, like he was trying to figure out what category she belonged in, and finding that none of his usual categories quite fit. I'm going to need the OR prepped. It's been on standby for the last 8 minutes, Claire said. Reyes blinked. How did you... I hadn't even... You would have, she said. I just got there first. Hawk had been listening to this exchange. She knew because she had been watching him in her peripheral vision, even while addressing Reyes, because watching the room without appearing to was a skill she had developed long before she ever set foot in a hospital. He was watching her now with a different quality of attention than he had turned on her at the beginning of the night. The dismissal was gone. What was there instead was something sharper, more focused, the look of someone recalibrating. What's your background? He said. Nursing school. 14 years in trauma care. She did not elaborate. She rarely did. That's not... He stopped himself, started again. I've been in rooms with a lot of medical personnel. You don't move like 14 years in trauma care. Claire did not respond to that. Where'd you train before nursing school? He asked. Pre-med. I left before I finished. Why? Life had other plans. She checked his IV line, adjusted the drip rate. You ask a lot of questions for someone who just had shrapnel removed from his chest cavity. I ask a lot of questions because it's my job, he said, even when I'm horizontal. It's mine too, she said, and right now mine is keeping you breathing. So if you, based on your breathing pattern and the way you were holding your left arm, and 3 other things I noticed when I walked in, that I don't have time to explain right now. She looked at him steadily. Does it matter how I knew? You're breathing, that's the point. Something moved in his face again. That same unreadable thing she had seen before, somewhere between reassessment and something that might, in another context, have been respect. You're not what you say you are, he said. The room did not change. The monitors kept their rhythm. Maya kept moving, precise and efficient, pretending she was not listening to every word. Claire kept her hands steady and her face neutral. I'm exactly what I say I am, Claire said. I'm your nurse tonight. That's all you need to know. That's not all I need to know, Hawk said quietly. I've worked with people like you before. Not in hospitals. Claire said nothing. People who move like you move, he continued, his voice lower now, almost private in the way it cut under the ambient noise of the bay. And see what you see, and know what you know before they should know it. That's not hospital training. That's something else, and I want to know what. The monitor beeped. Claire checked his pressure, made a note, handed the chart update to Maya without looking away from Hawk. You should rest, she said. You're going into OR in about 40 minutes. I don't rest easy when I don't know who's in the room with me, he said, force of habit. Then tonight's going to be uncomfortable, Claire said, because you're going to have to trust me without having the information you want. And that, she added, with something that was not quite a smile but held the shape of one, is also a force of habit, just not yours. He held her gaze for a long moment, and then slowly the tension in his shoulders eased. Just slightly, just enough. Hawk, he said. My name is Jake. My team calls me Hawk. Claire nodded once. Nice to meet you, Jake. Claire. He said her name like he was testing it, like he was deciding whether it was real. That's your actual name? Tonight it is, she said. That almost smile crossed his face again, and this time it made it all the way. It was brief and crooked, and held a kind of hard-worn humor that only belonged to people who had been through enough to know that the funny thing and the terrible thing were often the same thing. Fair enough, he said. Claire turned to check the supply tray, her back to him for the first time in the past 20 minutes. And as she did, she reached across the tray for a fresh set of gauze, and the sleeve of her scrubs pulled back, just slightly, against the edge of the tray. Just enough. Jake's voice stopped being quiet. Stop, he said. It came out the way orders came out of people who were used to giving them. Not loud, but with a weight behind it that made he should not have been sitting up. His vitals were not where they needed to be for him to be sitting up, and she was going to have to address that in a moment. But his eyes were locked on her left forearm, where the sleeve had ridden up, and the expression on his face was something she had seen before. Not shock, exactly. More like the specific, disoriented look of a person who has found something in a place it absolutely should not be, like reaching into a coat pocket and finding a live grenade. That tattoo, he said. His voice had changed entirely. The combativeness was gone. The authority was gone. She did not pull her sleeve down. She did not confirm or deny. She just looked at him with those steady eyes that had not changed once since the moment she had walked through the bay doors, and waited. That's not... Jake stopped. He looked at the tattoo, back at her face, back at the tattoo. The mathematics of it was happening behind his eyes in real time. She could see it, the way everything he thought he knew about this room, and this night, and this woman was rearranging itself into a new configuration. That insignia, I've seen that mark once in my life, in a classified briefing. It belongs to a unit that, Jake, Claire said. He stopped talking. Your oxygen saturation is dropping, she said, and you need to lie back down. Who are you? He said, and this time it was not the contemptuous demand. I'm your nurse tonight, she said, and she pulled her sleeve back down. Maya was very carefully not looking at either of them. The monitor beeped steadily. Jake lay back, his eyes on the ceiling, his expression that of a man solving a problem that did not have a clean solution. Claire went back to work. Her hands did not shake. Her face did not change. The bay around them hummed with its ordinary rhythm, the sounds of machines and movement, and the ordinary, extraordinary urgency of a trauma center at midnight. But the room was different now. It was different because Jake had stopped looking at Claire like a floor nurse and started looking at her like something he could not name, and did not have the clearance to ask about, and could not stop thinking about. And Claire moved through it all with the same unshaken calm, the same precise economy, the same quality of stillness that did not belong to 14 years of hospital work. The tattoo on her forearm lay hidden under her sleeve. The secret lay hidden under that. And the woman who carried both of them kept doing her job, because her job had always been the same, whether she did it in a hospital or in a desert, or in a room that nobody in the world was allowed to know existed. She kept people alive, and she was very, very good at it. The OR was 40 minutes out, and Claire was not wasting a single second of them. She moved back to the supply tray without a word, restocked what had scattered when Jake grabbed her, and picked up exactly where she had left off. The tattoo was covered again. Her sleeve was down. Her face was the same face it had been since she walked in. Composed, focused, giving away nothing. But the room was not the same room it had been 60 seconds ago. Maya was moving with her head down, jaw tight, the way she moved when she had witnessed something that had shaken her and did not intend to show it. The respiratory tech by the door had taken 2 steps closer to the gurney without seeming to realize he had done it. Even the monitors seemed louder somehow, their rhythmic beeping filling a silence that felt loaded. Jake had not taken his eyes off Claire's sleeve. That mark, he said, and his voice was different now, quieter, stripped of everything that wasn't essential. The one on your arm, I need you to tell me what it means. It means I've been places, Claire said. She was checking his IV line. Lie still. I've been places too, he said. I've been to a lot of places most people don't have clearance to know exist. And that mark, that specific mark, I saw it once in a briefing that was classified at a level where I was the lowest ranking person in the room. So when I tell you I need to know what it means on your arm, I'm not making small talk. Claire did not answer. She handed Maya a chart update and picked up the portable pulse oximeter. Who are you? Jake said, for the 3rd time tonight. But this version was different from the first contemptuous demand and different from the second stunned whisper. This version was flat and deliberate, the voice of a man who had moved past shock and into the specific gear that was pure professional inquiry. I am asking you directly, who are you? Claire clipped the oximeter to his finger, watched the reading climb, watched his face. I'm the person keeping you alive tonight, she said. That's who I am. Jake was quiet for 4 seconds. She counted them without appearing to. Then he said, what was the unit's primary theater of operation between 2009 and 2014? The room did not move. The monitors did not change. Claire's hands did not stop. But something happened behind her eyes. Something fast and involuntary, the way a person blinks when a light comes on in a dark room. It was there and then gone, and anyone who was not watching for it would have missed it entirely. Jake saw it. Southwest Asia, he said softly, and Eastern Africa. Joint operations, no official record. The unit was never acknowledged. It doesn't exist on paper. He looked at her forearm. But that mark exists on your arm. Jake, Claire's voice was even. Your saturation is at 91. I need you to breathe. I'm breathing fine. You're breathing shallow because you're agitated, and every time you move that left arm, you're putting pressure on the fragmentation site. So I need you to stop talking, stop moving, and let me do what I'm here to do. And after you've done what you're here to do, he said. After that, Claire said, you'll be in recovery, and it won't be my problem anymore. She moved to his left side, angled herself between him and the door with a positioning that looked entirely like clinical protocol and was not entirely clinical protocol. Maya noticed. The respiratory tech did not. You know what the unit I'm thinking of was called, Jake said. I don't discuss things I know or don't know, Claire said, and neither should you. The people in that briefing, he said, ignoring her completely, the way people with his level of training sometimes did when they had locked onto something. They talked about a commanding officer, the unit's CO. They didn't give a name. They said, he paused, recalling, precise the way people were precise when something had been filed into long-term memory rather than just skimming their awareness. They said the CO had been operating in theater for 11 years, that the unit's mission success rate was 100%, that the CO had never lost an asset. He looked at her. Never, not one, in 11 years. Claire said nothing. The monitor alarmed briefly. She silenced it, adjusted his drip, and moved to the foot of the gurney to check his chart without showing him her face. They also said, Jake continued quieter now, that the CO disappeared from active record in 2017, that there was a cover story, a new identity, that the unit was officially dissolved. A pause. Officially. Jake, Claire said, her back still to him, you have a third fragment sitting 6 millimeters from your pleural space. If it shifts while you're in the middle of whatever this is, Dr. Reyes is going to have a very long night. I'm not moving the fragment. You're moving everything around it, which is close enough. He stopped talking. She turned back. His eyes were still on her, but something had changed in them. The interrogation had stepped back. What replaced it was something harder to categorize. A kind of reckoning, maybe. The face of a man who had been doing math in his head and had arrived at an answer that did not fit neatly anywhere. The door to Bay 3 opened. Not Maya, not Dr. Reyes. It was the medic who had come in with the transport. The young one, 25 or so. And he was breathing harder than he should have been. And his eyes went straight to Jake, bypassing Claire entirely in the way that people from that world bypassed civilians entirely. Hawk, he said. Jake's attention snapped to him like a compass needle finding north. Rodriguez, he said, what's the situation? Bravo and Finn are stable, Rodriguez said. He crossed to the gurney in 4 steps, lowered his voice, though not low enough. Danny's in surgery. They're saying it's a 50-50. The change in Jake was immediate and total. Something in his face went through a door and closed the door behind it. His vital signs spiked on the monitor in a single sharp peak, and Claire was already adjusting before the alarm finished sounding. Jake, she said, I need your pressure to come down, right now. He was not listening to her. His eyes were on Rodriguez and every muscle in his body was locked. Which surgeon? He said. Patel, they said. I don't know Patel. Hawk, I don't know Patel, and Danny's in a 50-50, and I'm lying in this bay. He started to push himself up. Claire put her hand on his chest. Not hard. She did not need to push hard. The quality of the contact stopped him, the same way a hand on a live wire stops you, not because of the force, but because of what the contact tells you. He looked down at her hand, back at her face. You cannot go anywhere, she said. Her voice was not loud, and it was not kind, and it was not unkind. It was simply absolute. You are not stable. If you walk out of this bay, you will not make it to the elevator. I am not being dramatic. I am reading your numbers, and I am telling you the truth, which is something I always do. Your man is in surgery. The best thing you can do for him right now, the only thing, is stay in this bay and let me make sure you're alive to see him come out. Jake stared at her. Rodriguez stood 2 feet away, silent, watching with the look of someone who had seen Hawk face down a lot of people and had never once seen him look at anyone quite like that. 5 seconds. 10. Jake lay back. If he doesn't make it, he said, and his voice was so controlled it sounded like something mechanical. I need to know the moment it happens. Not after, the moment. I'll make sure you're told, Claire said. Not by someone else, by you. She held his gaze. Okay, Rodriguez exhaled. He looked at Claire, and for the first time since he had come through the door, he was actually seeing her. Not as furniture, not as civilian, but as a person. His eyes moved to her arm, where the sleeve was still down, and back to her face. And something shifted in his expression that she filed away without reacting to. Rodriguez, Jake said, go back to Bravo and Finn. Stay with them. Hawk, I should be. That was an order. A pause. Rodriguez straightened. Yes, sir. He looked at Claire once more, that same searching, unresolved look, and left. The door swung shut. The bay was quiet. Jake closed his eyes. He did not look like a man resting. He looked like a man containing something enormous through sheer structural will, the way a dam contains water, not by eliminating the pressure, but by refusing to break under it. Claire worked in silence. She had learned, a long time ago, that silence after that kind of blow was not emptiness. It was the sound of someone doing what Jake was doing, which was surviving the thing they had just been told. And the best thing you could do in that silence was exactly what she was doing, keeping the vital signs steady, keeping the drip rate right, keeping everything around the person as quiet and controlled as possible, and letting them have the time they needed to get to the other side of it. It was 9 minutes before he spoke again. How do you do it? He said. She did not ask what he meant. Practice. That's not an answer. It's the only honest one. She made a note on his chart. You stop expecting it to hurt the way it used to. It still hurts. It just becomes something you carry differently after a while. He opened his eyes. After how long? Longer than anyone tells you, Claire said. Shorter than you think you'll need. Jake was quiet for a moment, then, you've lost people. It was not a question. She did not treat it like one. Yes, she said, in the field. A pause that lasted exactly 1 breath. Among other places. He looked at the ceiling for a long time. When he spoke again, his voice had lost most of its edges. Not soft, exactly. More like weathered. How many years? Enough, she said. How do you end up here, he said, after all of that? How do you end up in a trauma bay in the middle of the night, taking care of people like me? Claire capped the syringe she had been holding, set it down and looked at him directly. People like you are exactly why I'm here, she said. Not in spite of it, because of it. He looked at her for a long moment. Who are you? He said again, but this time it was none of the previous versions. It was simpler than all of them. It was just a person asking another person a genuine question, the kind that does not have an agenda behind it, just the plain human need to understand who is standing in the room with you. Claire looked at him for a long moment of her own. Then Dr. Reyes pushed through the door with 2 residents behind him, tablet in hand, surgical gloves already on, moving with the particular velocity of a surgeon who had reviewed imaging and made his decision. We're moving up the timeline, Reyes said. That fragment is not staying where it is. I want him in OR2 in 15 minutes. He looked at the chart in Claire's hands, then at her face. You had it right. 3rd one was the problem. I know, Claire said. Reyes almost smiled. Almost. He turned to his residents. Get OR2 prepped and tell anesthesia we're moving. Now, the room shifted into a different gear. The gear of a team that has moved from preparation to execution, where every action has a destination and every second has weight. Claire coordinated the pre-OR checklist with the same efficiency she brought to everything else, double-checking lines, confirming medication levels, making sure the handoff to the surgical team was clean and complete and left nothing to chance. Jake watched her through all of it. He watched her the way he had stopped watching her earlier, not with challenge, not with suspicion, not with the contempt that had been there at the beginning of the night when he grabbed her wrist and shoved her back. He watched her the way you watch someone when you had stopped being able to put them in a category, and the absence of a category was doing something strange and irreversible to the way you understood the room you were both in. "Claire," he said, when Reyes had stepped out for 1 minute and the residents were occupied with equipment. She looked up. "When I come out of this," he said, "I need 5 minutes. Patients usually sleep after surgery," she said. "I don't sleep after surgery. Most people do. I'm not most people." "No," Claire said quietly, "you're not." Something passed between them, brief, dense, unspoken. The kind of thing that happens between people who have both been to the places that cannot be named, who have both carried the weight that does not go on forms, who recognize in each other something that they have stopped expecting to find anywhere, and especially not here, and especially not tonight. Then the door opened and the surgical team came in, and the moment was gone, swallowed by protocol and motion and the machinery of emergency medicine. They were transferring him to the gurney for transport when it happened. Rodriguez came back through the door at a run, not the controlled movement of a trained operator, but the raw, stumbling speed of someone who has just received news and is carrying it in their body before they have finished processing it in their mind. His face was the color of concrete. Every person in the bay stopped. "Danny's out of surgery," Rodriguez said. Jake went completely still on the gurney, and his voice was a single word with no air around it. Rodriguez opened his mouth, closed it. The residents looked at the floor. Maya looked at Claire. Claire crossed the room in 4 steps and stood in front of Rodriguez, putting herself between him and Jake, not blocking but anchoring, giving the moment a center so it did not fly apart. "Rodriguez," she said, quiet, level. "Tell him." Rodriguez looked at Jake over Claire's shoulder. His jaw worked. "He made it," Rodriguez said. His voice broke on the last word, and he did not try to stop it from breaking. "He's in recovery. Danny made it through." The room exhaled. Jake did not make a sound. His eyes closed. Every muscle in his body, which had been locked for the past 2 hours in the particular controlled tension of a person holding themselves together by force of will, released all at once. And for one unguarded second, he looked exactly like what he was. A man who loved his people and had been terrified of losing one and had not let himself show it until now. Claire watched that second happen and did not look away from it. She did not give him the privacy of looking away. She witnessed it because that was what he needed. Not space, but witness. Someone to see the thing he had been carrying and confirm that it was real, and it was allowed. Then the second passed and he was Hawk again. He opened his eyes. They were clear. "Let's go," he told the surgical team. They moved. As the gurney rolled toward the bay doors, Jake turned his head and found Claire. She was standing where she had been, still and steady, and she met his eyes without flinching. "5 minutes," he said, "when I'm out." "We'll see," Claire said. The gurney pushed through the doors. Claire stood in the empty bay, the monitors quiet now, the room stripped of its urgency and left with just the aftermath. The used supplies, the memory of the past 2 hours, the particular echo that trauma bays held after the crisis had passed, and the person had gone on to the next stage of their survival. Maya came to stand beside her. "That was something," Maya said. Claire did not answer. "Claire," Maya lowered her voice, "his medic, Rodriguez, When he came back that second time, he was looking at your arm. He was looking at it the same way Hawk was. Claire started stripping her gloves. Maya, she said. Yeah. Document the chart, flag Dr. Reyes for the post-op handoff, and go check on bays 1 and 2. Maya watched her for a moment. You know I'm not going to stop being curious about this. I know, Claire said. But tonight, you're going to anyway. She tossed the gloves in the bin, picked up her tablet, and walked out of bay 3. In the corridor, she paused, pulled out her phone, looked at it for a long moment. No messages, no missed calls. Nothing that meant anything had changed. She put the phone back in her pocket. Down the hall, through 2 sets of doors, a man with a tattoo she recognized was being wheeled into surgery. A medic with too many questions was sitting with 2 of his teammates in Bay 1. And somewhere in this building, a federal agent had just badged in at the front desk and asked which department handled the incoming military transport. Claire did not know that last part yet. She would. She found out 11 minutes later. She was at the nurse's station updating Jake's pre-op file when Karen at the front desk called back to the charge desk with a particular careful voice she used when something was happening that she did not understand and wanted someone else to handle. Claire, there's a gentleman here asking about the military transport that came in tonight. He's showing federal credentials. He's asking for the supervising nurse. Claire set her tablet down. What agency? A pause. Muffled voices. He says DHS. But Claire, he's not in uniform, and he came in through the side entrance and not the main, and something feels off. Don't give him anything, Claire said. Tell him the supervising nurse will be right out. Keep him at the desk. She hung up and stood still for exactly 3 seconds. Then she walked down the corridor toward Bay 1. Rodriguez was sitting in the chair beside Bravo's bed, forearms on his knees, head down in the posture of a man running on fumes and adrenaline and not much else. He looked up when Claire came through the door, and the way his eyes sharpened told her he had not actually been resting. He had been thinking, probably thinking about her. I need you to listen to me carefully, Claire said. She did not lower her voice, but she pitched it so it did not carry past the 2 of them. There is a federal agent at the front desk asking about your transport. I don't know yet if he's legitimate or if he's something else. I need to know if anyone on your team made contact with outside parties before you were transported here. Anyone at all. Family, chain of command, anyone. Rodriguez straightened. The exhaustion dropped off his face like a mask removed. No, protocol was a communications blackout from the moment of the incident. Nobody contacted anyone outside the immediate response chain. Who was in the response chain? Base commander, transport coordinator, and the hospital intake line. That's it. Then how does a federal agent know you're here within 2 hours of arrival? It was not a question. It was the kind of statement that answered itself in the asking, and Rodriguez heard it the same way she meant it, and his face did exactly what she expected it to do. That's not right, he said quietly. No, Claire said. It's not. She left him with that and went to find the federal agent. His name, according to the credentials he handed her at the front desk, was Agent Dennis Collier, Department of Homeland Security, and he was somewhere in his mid-40s with the build of a former athlete who had spent the last decade behind a desk and the eyes of someone who had not. He shook her hand with the precise pressure of a person who had been trained to project authority without aggression, and he smiled at her with a smile that did not reach those eyes at all. Miss Merritt, he said. It's Claire, she said. What can I do for you, Agent Collier? I understand you had a military transport come in tonight, special operations personnel. I'm not able to discuss patient information, Claire said. Privacy regulations. I'm sure you understand. Of course, he nodded smoothly. I'm not asking for medical information. I'm asking for confirmation of transport arrival. That's a matter of logistics, not privacy. He smiled again. Just routine coordination between agencies. These things can get complicated on the administrative end when military and civilian facilities intersect. Claire looked at him for a moment. In her experience, which was extensive and specific, and included a significant number of people whose job it was to lie convincingly, the ones who led with the word routine were almost never dealing with anything routine. Routine situations did not require the word. The word was a flag, not a fact. "I'll need to see your credentials again," she said. "The full credential package, not just the badge." Something moved in his face. Brief, gone. He reached into his jacket and produced the credential wallet, opened it fully, held it out. Claire took it, examined it with the thoroughness of someone who knew what she was looking for, which she did, because she had spent 3 years of her life working alongside people whose cover documentation was produced by the same offices that produce federal credentials. And she knew the difference between a real one and a very good replica. This one was real. That did not make her feel better. It made her feel precisely as cautious as she had been before, because a real credential established identity, not intent. And those were two very different things. She handed it back. "The patients from the military transport are in active treatment," she said. "I can confirm they arrived. I cannot give you access to them, to their records, or to any staff involved in their care without a court order or explicit written authorization from their commanding officer. Those are the rules, and they apply to every agency equally." Collier tilted his head slightly. "That's a very thorough answer for a floor nurse." "I've worked in trauma for 14 years, Claire said. "We deal with a lot of situations that require us to know the rules." He looked at her. She looked at him. "There's actually something else I wanted to ask you about," Collier said, and the smoothness in his voice shifted, almost imperceptibly, into something with more edge. Something a little outside the medical end of things. Claire waited. "Your personnel file shows you came to this hospital 7 years ago," he said. "Before that, there's very little. A nursing license issued in 2016, a year of residency at a facility in Maryland, and before that," he paused with the deliberateness of someone who had rehearsed the pause. "Very little, which is unusual." "Some people have thin records," Claire said. "It's not a crime." "No," Collier agreed. "It's not, but it is interesting, especially in combination with a few other things." He reached into the inside pocket of his jacket and produced a folded photograph. He unfolded it and held it up. It was surveillance quality, taken from a distance, slightly grainy, but clear enough. It showed a woman in tactical gear, face partially turned toward the camera, in a location that looked like the kind of location that did not appear on tourist maps. The woman had Claire's jawline, Claire's posture, the specific way Claire held her left arm slightly away from her body. That was the result of an old injury that had healed at a 3-degree angle off true. Claire looked at the photograph. Her face did not change. "Where did you get that?" she said. "Interesting question," Collier said. "Most people, when you show them a photograph and imply it might be them, say it's not them." "I don't make claims I haven't verified," Claire said. "Where did you get it?" He folded the photograph and put it back in his pocket. "I'm going to be direct with you, Miss Merritt, or whatever name you're going by. I'm not here to cause problems. I'm here because there are people who are very interested in the unit that tattoo on your forearm belongs to. And those people believe that someone connected to that unit may have information relevant to a current active investigation." Claire said nothing. "The unit was officially dissolved in 2017, Collier said, "but we both know that officially and actually are two different words." He watched her face. "There was an operation, 2016, Eastern Theater. The official record says it concluded successfully. The unofficial record has some gaps that people in my office find difficult to explain. And recently, very recently, those gaps have become relevant again." The front desk phone rang. Karen answered it, said something quietly, and looked at Claire with the expression she used when something needed immediate attention in the bays. Claire looked at her. held up one finger, looked back at Collier. "I'm going to need you to wait," she said. "Sit down. Don't go anywhere." She did not wait for him to agree. She walked back to Karen's desk. "What is it?" she said, low. "OR2 just called," Karen said, and her voice was careful, the way voices got careful when the news was the kind that needed handling. "They're asking for the nurse who triaged the military patient." "Hawk." They said, "Claire, they said there's a complication." Claire was already moving. The OR2 charge nurse met her outside the surgical suite doors. A woman named Patrice who had worked this hospital for 20 years and was not given to panic, and who was currently wearing the expression of someone containing panic through professional discipline alone. "The fragment shifted during prep," Patrice said, matching Claire's pace. "Reyes is handling it, but it nicked the pleural lining, and there's a bleed. Not catastrophic, but it's complicated the procedure. Reyes asked for you specifically." "Why me specifically?" Claire said. Patrice paused for one step. "He said you'd know things about the patient's physiology that weren't in the chart." His words. Claire pushed through the doors. The surgical suite had the particular focused intensity of a room where something had gone sideways, and the people in it were too skilled to panic and too experienced to pretend it had not. Reyes was at the table, his movements precise and controlled, talking to his team in the low, steady cadence of a surgeon managing a situation that required precision more than speed. He looked up when Claire came in. "His blood pressure drops differently than it should for this kind of bleed," Reyes said. "The response curve is wrong. It's compensating faster than the numbers justify, and then dropping faster than the compensation accounts for. It's like his autonomic system has been recalibrated somehow. Is there anything in his history that explains that?" Claire crossed to the monitoring station, looked at the readout, looked at the curve Reyes was describing. She recognized it. She recognized it because she had seen it before, in context that she was not going to explain in a surgical suite, in people who had undergone specific kinds of physiological conditioning that did not appear in medical histories because the programs that produced the conditioning did not appear in any record at all. "His pressure will stabilize at 90/60 and hold there longer than you expect it to," she said. "Don't compensate aggressively for the low pressure. His threshold is lower than a standard patient. If you push fluids to bring it up to a normal range, you'll overshoot and cause a secondary problem." Reyes looked at her for one long second. "How do you know that?" "Because I've seen this physiology before," she said. "Trust it." Another second. Reyes was a good surgeon, which meant he was also a pragmatist, which meant he understood that the question of how she knew was less urgent than the question of whether she was right. And in the absence of a better framework, her certainty carried weight. "Okay," he said. "Okay, talk me through it." She did. She stood at the monitoring station for the next 40 minutes, and she talked Reyes through it in the precise, technical language of someone who had overseen enough of these situations to know the specific points where standard protocol diverged from what this particular kind of patient actually needed. She did not explain where the knowledge came from. Reyes did not ask again. He asked specific questions, and she gave specific answers. And the curve on the monitor did exactly what she said it would do. And when it stabilized at the number she had predicted, Reyes exhaled through his nose, and she saw the set of his shoulders change. "That's remarkable," he said quietly. "He's stable," Claire said. "That's what matters." "Yes," he looked at her over his mask, "but that's still remarkable." She left the surgical suite and stood in the corridor outside the OR doors. And for 30 seconds, she just stood there and let herself breathe. Not because she was not shaken, but because there was a cost to the kind of precision she had just exercised, a specific tax that it levied on the part of her that she kept most carefully contained. And she had learned over many years that the cost had to be acknowledged, even if it could not be paid right now. 30 seconds. Then she straightened and walked back toward the front desk. Collier was still there, sitting exactly where she had left him, which told her something. A certain kind of operative, when given the opportunity of an unsupervised 10 minutes in a facility they were investigating, would not simply sit. They would move. They would learn the layout. They would locate secondary exits and communication points and the position of security cameras. The fact that Collier had not done any of that told her either that he was genuinely bureaucratic enough to simply wait, or that he was skilled enough to have done it all mentally from his seated position in the first 3 minutes. She was betting on the second. "Walk with me," she told him. She took him to the small consultation room off the main corridor, the one used for family conversations that needed privacy, and she closed the door and stood with her back to it and looked at him. "The operation you're referencing," she said, "the 2016 mission with the gaps. What specifically do your people think they're missing?" Collier's posture shifted. Not much, but enough to tell her that her directness had caught him off guard, which told her that he had been expecting her to continue denying. The expectation of denial was itself information. "There was an asset," he said, "local, embedded with a target organization for 3 years. When the operation concluded, the official record shows the asset was extracted successfully. But 18 months ago, the asset resurfaced, in a context that doesn't align with a successful extraction." "Define resurfaced," Claire said. "Connected with a network that your unit had been tracking, on the wrong side of that connection." He watched her. "If the extraction was not what the record says it was, if there were decisions made in the field that didn't make it into the official report, that matters now, because that asset is currently in a position to cause significant damage." Claire was quiet for a long time, long enough that Collier shifted in his chair. "The people who dissolved your unit," he said more carefully now, "they didn't do a thorough job. There are threads. Your name, whatever your name is, keeps appearing at the end of those threads. Not in ways that are accusatory, in ways that suggest you know things that could help us close this." "Who is us?" Claire said. "My office." "That's not an answer. It's the answer I have authorization to give." Claire looked at him. "Who sent you here tonight? Specifically, not DHS, not your office. Who told you to come to this hospital on this night and ask about this transport?" And there it was, the thing she had been watching for since he first smiled at her at the front desk. Not a flinch, not a tell in the ordinary sense, more like a pause that lasted a fraction of a second too long, a gap in the smooth, professional machinery, the place where the rehearsed version of the conversation hit something that had not been rehearsed. "My supervisor," he said. "Your supervisor's name," Claire said. Another pause, shorter this time, but there. "Deputy Director Walsh," he said. The room temperature did not change. The light did not change. Claire's face did not change. But something moved through her that was cold and fast and extremely precise. The feeling she associated with the moment in a field operation when the variable you had been tracking resolved into a specific and dangerous shape. Walsh. She knew that name. She knew it in the way she knew the fragment had shifted before the imaging came back. Not from data she could cite, but from the deep operational knowledge of someone who had spent years learning to read the architecture of things that were not supposed to be visible from the outside. Walsh was not DHS, or Walsh was DHS now, which was a different thing entirely from what Walsh had been in 2016. "I'd like you to leave the hospital," Claire said. Collier blinked. "Excuse me, I'd like you to leave," she repeated. "You're not getting access to the patients. You're not getting information from the staff. And the conversation we just had," she looked at him steadily, "did not happen. We're done." "Miss Merritt," his voice had an edge now. The smoothness was gone. "I came here with a reasonable request and a legitimate credential, and I have been entirely professional. If you obstruct a federal—" "I'm not obstructing anything," Claire said. "I'm exercising every right available to me as the supervising nurse in this facility to protect the privacy and safety of patients in my care. If you want to pursue this through official channels, I'll give you the name of the hospital's legal counsel, but you're going to leave. Now." She opened the consultation room door. Collier stood. He buttoned his jacket. He looked at her with the look of a man recalibrating, the same way Jake had looked at her in Bay 3, but where Jake's recalibration had moved towards something like recognition and respect. Collier's moved towards something harder and less readable. "You're going to want to think carefully about the position you're putting yourself in," he said. "I've been thinking carefully about positions for a long time," Claire said. "I'm good at it. Good night, Agent Collier." He left. She watched him go through the corridor and through the main doors, and she stayed at the window until she saw him get into a car. Dark sedan, government plates, but the plates were a Maryland issue and not a Virginia issue, and that distinction, small as it was, landed in her chest like a stone dropped into still water. She pulled out her phone. She looked at it for a long moment. There was a number she had not called in 4 years, a number she had been told was still active, that would be answered on the second ring regardless of the time, that was connected to the only person she trusted with what she was holding right now. She did not dial it yet. She walked back to the nurse's station, picked up her tablet, checked Jake's surgical status, still in OR, stable, and updated the chart for bays 1 and 2. She did everything she was supposed to do in the order she was supposed to do it, moving through the routine of the job with the same precision she had brought to every other moment of this night. But underneath that precision, something had shifted. Walsh was a name from a chapter she had closed, or believed she had closed. The specific sensation of that name in this corridor, in this context, in this night, was the sensation of a door she had locked from the inside, being tested from the outside. Not opened yet, but tested. She was at the medication station when Maya found her, and Maya had the expression she wore when she had information she was not sure whether to share. The look of someone standing at the edge of something and measuring the depth. "The medic," Maya said. "Rodriguez. He's been asking about you. Not in a patient questions way, in a, he wanted to know how long you'd been here, who hired you, whether Clare Merritt was your full name." Claire did not look up from the medication log. "What did you tell him?" she said. "I told him it wasn't my information to give," Maya said. "But Claire," she paused, "he also asked whether you had any visitors tonight, before the federal agent came." Claire's hands stopped on the medication log. "He asked that before Collier arrived?" she said. "By about 15 minutes, Maya said quietly. Claire set the log down. Rodriguez had asked about visitors before Collier showed up, which meant Rodriguez had been expecting someone to show up, which meant he had known or suspected that Claire's presence in this bay tonight was not the coincidence it appeared to be, which meant the question of who had sent Collier here tonight was not the only question that needed answering. She picked up her phone. This time, she dialed. It rang once. "I've been waiting," said the voice on the other end. A woman's voice, low and unhurried, with a specific quality of someone who had been sitting in the dark for a long time and was not surprised by the call. "Walsh sent someone," Claire said. A silence, brief and weighted. "How close?" the voice said. "He was in the building," Claire said. "He's gone now, but he'll be back." Another silence. "Then it's starting," the voice said. Claire looked at the window at the end of the corridor, at the dark outside, at the faint reflection of herself in the glass. A woman in scrubs, a hospital badge, a life built from careful pieces. "Yes," she said. "It's starting." She ended the call, put the phone in her pocket, and went to check on her patients. Jake came out of surgery at 2:17 in the morning. Claire knew the moment the OR2 doors opened because Patrice appeared at the nurse's station with the post-op summary in hand, and the particular expression of someone who had watched something difficult become something manageable, and was still processing the distance between those 2 points. She handed the summary to Claire without being asked. which was the kind of thing that happened when a person had spent enough time in a place that the people around them stopped waiting for requests and started anticipating needs. Claire read it in 30 seconds. Stable. Fragments removed. Pleural lining repaired. Blood pressure had behaved exactly as she had told Reyes it would behave, which she noted without satisfaction because satisfaction was not the point. The point was that Jake was breathing and his chest was intact, and the third fragment was out of his body and in a specimen tray. Recovery is asking if you want to be listed as primary contact for the patient, Patrice said. Yes, Claire said. Patrice wrote it down without comment. Claire went to check on Bravo and Finn in bays 1 and 2, because those were still her patients too, and the drama of the night had not changed that. Bravo, whose actual name she had learned from the intake forms, was Marcus Webb, age 31, from Savannah, Georgia, with a wife named Leanne and a daughter who was apparently 3 years old and obsessed with horses. Had a mild concussion and a dislocated shoulder that had been reset and was being held for observation. He was awake when she came in, sitting up slightly, watching the door with the alert even when damaged vigilance of his profession. "How's Hawk?" he said immediately. "Out of surgery," Claire said. "Stable." The exhale that came out of Marcus Webb was not a small thing. It was the exhale of a man releasing something he had been holding with both hands for hours. His head dropped back against the pillow, and for a moment he just breathed, and Claire let him, checking his vitals and his shoulder wrap without filling the silence. "Danny," he said. "In recovery," Claire said. "He made it." Another exhale. This one smaller, but deeper somehow, like the relief was reaching further down. "Rodriguez told me you—" Marcus stopped, seemed to choose his words. "He said you were something. Rodriguez doesn't say that about people." "Rodriguez doesn't know me," Claire said. "He knows enough," Marcus said. He watched her with that particular quality of attention that all of them had, Jake, Rodriguez, and now Marcus. The look of people who process the world by reading it, constantly and automatically, and who had read something in her that they recognized and could not quite place. "He said your arm." "My arm is fine," Claire said pleasantly. "That's not what—" Marcus almost smiled. "He said there's a tattoo." "Most people have tattoos," Claire said. "It's not unusual." "It is when it's that one," Marcus said. Claire set his chart down and looked at him directly. "Marcus, you have a concussion and your blood pressure is still higher than I'd like. I need you to rest. Your shoulder is going to hurt significantly more tomorrow than it does tonight, and you're going to want to have slept before that happens." He looked at her for a long moment. Then, "My daughter's name is Rosie," he said. "She drew me a picture before I deployed. A horse. Looked like a dog, but she said it was a horse." He paused. "I was thinking about that picture the whole time tonight, in the field before transport. Just that drawing." Claire stood still. "You're going to see that drawing again," she said. Quiet, certain in the way she was certain about his blood pressure curve, not from hope, but from a specific and grounded reading of facts. Something in his face broke, just slightly, in the way that certainty sometimes broke through the shell of a person who had been surviving on uncertainty for too long. He nodded once, jaw tight. "Get some sleep," Claire said. She picked up his chart and walked out. Finn was asleep in Bay 2, which was the best thing he could be doing, so she checked his vitals, noted everything was holding, and moved on. Rodriguez was in the corridor. He had been waiting for her. That was clear from the way he was positioned. Not pacing, not sitting, but standing with his back to the wall, in the particular way of someone who has chosen a spot and intends to stay in it until the thing they are waiting for happens. He straightened when he saw her. "The federal agent," he said. "Collier, what did he want?" Claire looked at him. "That's not information I can share with you." "It's information that affects my team," Rodriguez said, "which makes it mine." "It affects my hospital," Claire said, "which makes it mine. They're not the same thing." Rodriguez's jaw tightened. He was younger than Jake by several years, and he had not yet developed the full architecture of control that Jake carried, which meant his emotions were closer to the surface and moved faster. Right now, what was on the surface was frustration with something underneath it that was closer to fear. And Claire recognized the combination because she had seen it on people in the field. The fear that the threat they had been trained to face in specific environments had followed them into an environment where their training did not fully apply. "He asked about you," Rodriguez said, "specifically, before he asked about the transport. Karen at the front desk told me he came in asking for the supervising nurse by description before he even confirmed we were here. He knew your name before she gave it to him." Claire processed this without showing that she was processing it. "How does a federal agent know your name before he walks in?" Rodriguez said. "How does he know to come here tonight? How does any of this make sense?" "It makes sense to me," Claire said, "and right now that's enough." "It's not enough for me," Rodriguez said. His voice rose slightly, and he caught it and pulled it back down. "I have 4 men in this hospital. Hawk just came out of surgery. Danny is in recovery, and somewhere out there is the piece of whatever went wrong tonight that we haven't identified yet. Because the incident we responded to tonight was not random. And the fact that a federal agent showed up here 2 hours after we landed is not coincidental. And I am not going to stand here and pretend I don't see what I'm seeing just because you tell me it's handled." Claire looked at him for a long moment. "What did Hawk tell you," she said, "about me before surgery?" Rodriguez hesitated. "He said to watch you. Not in a threat way, he said to watch how you moved. He said he'd seen that before, and I'd know what he meant when I saw it." "And did you?" Rodriguez's eyes went briefly to her forearm. Her sleeve was down. It had been down since the OR. "Yeah," he said quietly, "I did." "Then you know that I am not your threat tonight," Claire said. "And you know that I have a reason for the way I'm handling Collier. And you know that asking me to explain myself in a hospital corridor at 2 in the morning is not going to get you what you actually need." "Then what's going to get me what I actually need?" he said. "Go back to your team," Claire said. "Stay with them. Don't talk to anyone who comes to this hospital asking questions, unless I'm present. Anyone. Agency, uniform, civilian. Nobody. Do you understand?" He stared at her. "Rodriguez," she said, with a particular weight she had learned to put into a sentence when she needed it to land like a command without being phrased as one. "Do you understand?" "Yes," he said. "Good." She walked past him toward the recovery unit. Jake was in the 3rd bay of recovery, separated from the other 2 post-surgical patients by a curtain, which was standard, and by the fact that the nurses had instinctively given him the bay farthest from the entrance, which was not standard but was the kind of thing that happened when the quality of a person's stillness communicated something about their need for controlled space. He was conscious. Not fully, not yet, but the particular fractional consciousness of someone coming up through anesthesia in the way that people came up who had been through enough of it that their body did it efficiently. Claire pulled a chair to his bedside and sat. She checked his lines, checked his monitor, noted his pressure holding exactly where she had said it would hold. Then she sat back and looked at him. In the aftermath of everything, the shove against the wall, the contempt, the questions, the OR, the long night, she looked at him and saw what she had seen from the beginning under all of it, which was a person who had spent so much time being the hardest thing in the room that he had partially forgotten how to be anything else, and who was now in the specific vulnerability of post-surgical half-consciousness, just a person, just a man who loved his team and was afraid of losing them, and had spent the last several hours holding that fear with a grip so tight it had made him aggressive and demanding and difficult. She understood that. She understood it in the specific way that you understood things that you recognized in yourself. His eyes opened. Not gradually, all at once, the way they had opened in the bay, fast and complete, like a switch. He looked at the ceiling first, then at the monitor, then at her. "You stayed," he said. His voice was rough from the intubation and the anesthesia, but it was him, fully him. "You asked me to be here when you came out," Claire said. "I didn't think you'd actually—" He stopped, reassessed. "Your 5 minutes." "Whenever you're ready," she said. He was quiet for a moment. The monitor beeped. Someone in another bay coughed softly. The recovery unit had its own particular quality of quiet, different from the trauma bay quiet, slower, more careful, the quiet of things moving from crisis toward continuation. "Danny's okay," Claire said before he could ask. "Bravo and Finn are stable. Rodriguez is with them." Jake closed his eyes for 3 seconds. When he opened them, the thing she had seen in the surgical bay earlier, that single, unguarded moment of relief, was present again, more quietly this time, without the edges of crisis around it. "Thank you," he said. And the way he said it was entirely different from any other way he had spoken to her all night. No command structure, no testing, no assessment. Just 2 words, and the full weight of what was behind them. "You're welcome," Claire said. He looked at her. The roughness was still in his voice, but his eyes were sharp, the anesthesia burning off fast the way it did in people with his kind of conditioning. The agent, Collier, what did he actually want? Claire had expected this question. She had decided sometime in the past hour what her answer would be. Not a lie. She did not lie to patients, but a version of the truth that was sized for this particular moment and this particular person, given what he needed right now, which was rest and stability and not a new operational crisis introduced from the bedside. "He wanted information about your transport," she said. "I didn't give him any." "That's not all he wanted," Jake said. "No," she said, "it's not, but the rest of it is mine to deal with." He looked at her steadily. The clinical monitoring beeped. "The tattoo," he said. She waited. "I've been running through it since the bay," he said. His voice was measured, careful in the way that people were careful when they were working through something real. "The unit I saw in that briefing, the CO they described, 11 years, 100% success rate, never lost an asset, and then dissolution, new identity, disappearance." He held her gaze. "The way you talked Reyes through my physiology, the way you knew the pressure curve, the way you cleared Collier out of this building in about 3 minutes." A pause. "You're not a nurse who did some military service. That's not what you are." "Jake," Claire said. "That unit's CO," he said. "The person in that briefing. They said she was the most effective field commander they had encountered in a generation. That she had run operations that officially did not exist and would never exist, in places that officially she had never been, and that she had brought every single person home. Every one." His voice had dropped very low. "Until the last operation, 2016, and after that, nothing. She disappeared." The recovery unit was very quiet. Claire sat with her hands still in her lap and her face calm, and let him arrive at the place he was arriving at. "I shoved you into a wall," he said, flat. Not quite an accusation, not quite an apology. The voice of a man who had just completed a calculation and was looking at the answer with something approaching genuine remorse. "I called you a floor nurse. I told you to get someone experienced." "You did," Claire said. "You had been running operations before I finished basic," he said. "Something like that." He was quiet for a long moment. When he spoke again, his voice was rough in a different way than the anesthesia roughness. "I'm sorry," he said, "for the way I spoke to you, for—" He paused. "For all of it. You were injured, in pain, and frightened for your team," Claire said. "People behave badly when those things are true. I've seen it a lot." "That's not an excuse," he said. "No," she agreed, "it's not, but it is a reason. And I'm not holding it against you." She looked at him steadily. "What I need you to do right now is rest. Your body has been through significant trauma tonight, and the next 12 hours are important. Whatever conversation you want to have with me, whatever questions you still have, they will still be available after you've slept. I don't sleep easy when the situation isn't resolved, he said. I know, she said, but the situation is as resolved as it's going to be at 3 in the morning. Your team is safe. You're stable. Everything else can wait. He held her eyes for another long moment. Then, with the deliberateness of a person choosing to stand down for the second time in one night, his shoulders settled. Tell me one thing, he said. She waited. The last operation, 2016, the gaps in the record. His voice was careful, precise, almost gentle in the way that people were gentle when they were handling something they suspected was fragile. The asset that didn't come home the way the record says. Was it? He stopped, started again. Was it something that had to be done, or was it something that he couldn't finish it? Claire looked at him for a long time. Get some sleep, Jake, she said. She stood, checked his monitor one last time, and walked toward the recovery unit door. Claire, he said. She stopped. Your real name, he said, when you're ready to tell me. She stood at the door with her back to him for 3 seconds. Then she walked out. In the corridor, she stopped. Her phone had vibrated twice while she was sitting with Jake. She pulled it out now. 2 messages. No name on the sender, just a number she did not recognize, which was itself information. The first message had come in at 2:41. It was 4 words. We need to talk. The second message had come in at 2:48. 7 words this time. I know what Walsh is looking for. Claire stood in the corridor and read both messages twice. Her face was still. Her breathing was even. But her mind had gone to that particular level of operational clarity that it reached when the variables stopped being abstract and started being real and immediate and pointed directly at the thing she had spent 7 years building. She did not reply to the messages. She went back to the nurse's station, pulled up the hospital's security access log for the night, and went through every entry from the past 4 hours. Every badge scan, every door, every camera timestamp. She found what she was looking for at 1:53, 18 minutes before Collier had appeared at the front desk. A service entrance, east side of the building. Badge access via a visitor pass issued that afternoon for a routine HVAC maintenance visit. The pass had been used at 1:53 to enter and had not been used again to exit. Whoever had come in through the service entrance at 1:53 was still in the building. Claire put the access log down and looked at the corridor in both directions. 14 years of working in this hospital had given her a map of it that was essentially architectural. She knew every junction, every room, every secondary exit and service access point with the automatic knowledge of long familiarity. She also knew which of those spaces a person could occupy without appearing on a camera. There were 7 such spaces. She started moving. She found him in the 4th one, a supply corridor off the east wing, between the linen storage and the medical records room, standing in the dark with the stillness of someone who had done exactly this, in exactly these conditions, many times. He was older than she remembered, or maybe she was just older than she remembered. It was hard to tell the difference sometimes in the people from that life. He was a man she had known by the name Garrett. She had never known his last name. In the world they had both come from, last names were either everything or nothing, and with Garrett they had been nothing. You're going to give me a heart attack, she said. I sent messages, Garrett said. I got them. She looked at him. He looked the same as he had the last time she had seen him, which was at an airfield in a country she was not going to think about right now, which was 7 years ago. He had the same careful eyes, and the same economy of movement, and the same quality of being simultaneously completely present and completely unreadable. How did you get in? HVAC pass, he said. Don't worry, the unit really did need servicing. You had 6 hours to plan this, she said. I had 4, he said. Walsh moves fast. Tell me about Walsh, Claire said. Walsh is not what he's presenting as, Garrett said. He went to DHS 8 months ago from a private defense contractor called Helion Group. Before Helion, he was with a domestic intelligence division that was dissolved, officially, in 2018. Officially, Claire said. The division was dissolved, Garrett said. The people were not. They reassembled under private contract and the work continued. Different funding, same objectives, no oversight. He looked at her. Walsh was running the 2016 debriefing, the one that built the file on your unit. Claire was very still. He's not looking for information about the 2016 operation, Garrett said. He already has information about the 2016 operation. What he's looking for is the asset. The asset resurfaced, Claire said. The asset never left, Garrett said. That's the part he knows and you don't. The extraction in 2016, the one the record calls successful, the asset was extracted. Claire, I'm telling you the asset has been inside Helion Group for the past 4 years. Walsh has been running the asset since 2021. The corridor was very quiet. Something moved through Claire that was cold and specific and settled in her chest like a weight. Then Walsh isn't trying to find the asset, she said slowly. No, Garrett said. He's trying to find out what I know about the asset, she said. Whether I can identify the asset's current position, whether I'm a threat to their operation. That's my read, Garrett said. That means Collier coming here tonight wasn't reconnaissance, Claire said. It was assessment. He wasn't gathering intelligence about my unit. He was gathering intelligence about me, about whether I'm still active, whether I'm a liability. Or an asset, Garrett said quietly, depending on which way they decide to move. Claire looked at him for a long moment. Then she looked at the wall, at nothing, at the specific middle distance where people looked when they were processing something that required the full architecture of their attention. The military transport tonight, she said, Jake's team, their operation, was connected to Helion Group's theater, Garrett said. She turned and looked at him sharply. Not directly, he said quickly. Jake's team was not targeting anything connected to Walsh, but they were operating in the same geographic space. And something they encountered, something that triggered the incident that put them in this hospital, was peripheral to a Helion operation. He paused. That's why Collier showed up here tonight. It wasn't just about you. It was about what Jake's team might have seen. The weight in Claire's chest became something more complex, something that had a direction. Jake, she said. And his team, Garrett said. Yes. She turned and walked back toward the recovery unit. Claire, Garrett said behind her. She stopped. Walsh knows where you are, he said. He's known for 18 months. He let it sit until tonight because tonight gave him a reason to move. Now that he's moved, he paused. He's not going to stop. I know, Claire said. That means this life, Garrett gestured, a small motion that encompassed the hospital, the corridor, the badge on her chest, all of it. This is over, whether you want it to be or not. She stood with her back to him for a long moment. Then she said, I need 1 more hour. For what? Garrett said. To finish my shift, Claire said. She walked back to the recovery unit, pushed through the doors, and went to Jake's bay. He had not slept, which did not surprise her. He was lying with his eyes open, looking at the ceiling, doing what she suspected he had been doing since she left, running through the same information she had been running through, from a different angle, arriving at a different but adjacent set of conclusions. He looked at her when she came in. Something changed, he said immediately. She pulled the chair back to his bedside and sat down. I'm going to tell you something, she said, and when I'm done, I'm going to need you to listen to what I ask you, without the version of you that doesn't take orders from people he's just met. The version that does what makes tactical sense. Can you do that? Jake looked at her. Something in his face had reorganized itself into the focused, stripped-down clarity of a person who had moved past all the surrounding noise into the essential thing. Talk, he said. She talked. Not everything, not the full history, not the names, not the operational details that were not hers to share, but the shape of it. Walsh, Helion, the asset, the reason Collier had come to this hospital, the reason it was not just about her, but about his team. She gave him the information he needed to understand the geometry of what was happening, and she gave it to him straight, the way she had always given information to people who were going to have to act on it. He did not interrupt. He did not ask questions. He listened the way people listened when the information was real, and the stakes were clear, and they understood that the time for questions was after. When she finished, the recovery unit was very quiet. Jake looked at the ceiling. "Rodriguez," he said. "Yes," Claire said. "He knew something was wrong before Collier arrived," Jake said. "He asked about you before the agent showed up." "I know," Claire said. Jake turned his head and looked at her. The look was direct and unambiguous and completely clear of everything that had been in it at the beginning of the night. The contempt, the dismissal, the testing. What was there now was the face of a person who had arrived at a moment of simple and serious decision. "What do you need?" he said. "I need you to trust me," Claire said. "For the next hour. That's all I'm asking." Jake looked at her for exactly 2 seconds. "You have it." She stood, checked his monitor one final time, and walked out of the recovery unit. She did not hesitate at the door. She did not look back. The hour she had asked Garrett for was already running, and she intended to use every minute of it. Her first stop was Rodriguez. He was exactly where she had told him to be, Bay 1, beside Marcus, both of them awake, talking in the low voices of people who had survived something together and were still processing the surviving. They stopped talking when Claire came in. Rodriguez read her face the way trained people read faces, fast and without appearing to, and he was on his feet before she opened her mouth. "We need to talk," she said. "All 3 of you. I'm bringing Finn in." "Finn is asleep," Marcus said. "Finn can sleep later," Claire said. She was back in 2 minutes with Finn, who was 26 years old and had a bandaged left hand and the slightly dazed quality of someone who had been pulled out of the first real sleep he had gotten in 36 hours. He looked at Claire with the particular expression of young people who were trying to assess a situation and had not yet gathered enough data. Claire closed the bay door. She stood in the center of the room and looked at all 3 of them. Rodriguez, sharp and tense. Marcus sitting up with the controlled discomfort of a man whose shoulder was reminding him of its existence. Finn blinking himself the rest of the way awake. And she made a decision that she had been approaching all night and had now arrived at fully. She pushed her left sleeve up. Not incidentally, not because something caught on the edge of a tray. Deliberately, completely, rolling the sleeve to the elbow and holding her forearm so all 3 of them could see it clearly in the baylight. The tattoo was not large. It was precise, a specific geometric mark that to anyone outside a very limited circle looked like nothing more than a personal design, a bit abstract, the kind of thing someone might choose because it was visually interesting. To the people inside that circle, it was a rank designation, a unit identifier, and a record of something that had never been written down anywhere. Rodriguez made a sound that was not quite a word. Marcus stared. Finn looked at the other 2 to calibrate his reaction, saw what was on their faces, and looked back at Claire with his mouth slightly open. "The unit on the briefing," Rodriguez said. His voice was barely above a whisper. "The one Hawk described, from the classified—" He stopped, started again. "That is the CO's mark. That is the commanding officer's personal designation." "Yes," Claire said. "You're the CO," Rodriguez said. "I was," Claire said. The bay was very quiet for a moment that felt longer than it was. "How long have you been here?" Marcus said. His voice was careful, not accusing, genuinely trying to understand the architecture of something that had rearranged itself around him. In this hospital, how long? 7 years, Claire said. Undercover, Rodriguez said. Under a different name, Claire said. There's a distinction. Is there, Rodriguez said, and the edge in it was not hostile, but it was real. Yes, Claire said simply. One is operational deception, the other is survival. She looked at him steadily. I'm telling you this now because you need the context for what I'm about to tell you next. Not because you're entitled to my history, because the situation requires you to understand who is in the room with you. Rodriguez held her gaze. Then he nodded, once, the nod of someone accepting terms they did not fully like, but recognized as reasonable. Collier came here tonight for 2 reasons, Claire said. One was to assess whether I'm still active and whether I represent a threat to an ongoing private intelligence operation being run by a man named Walsh through a contractor called Helion Group. The second reason was your team. Marcus straightened. Finn stopped blinking. Something your team encountered during the operation tonight, Claire said, was peripheral to a Helion operation. Walsh doesn't know exactly what you saw or heard, but he knows your team was in that geographic space, and that's enough to make you a loose end he wants to evaluate. Evaluate, Finn said. It was the first word he had spoken. He said it with the particular flatness of someone who understood exactly what the word meant in this context. Yes, Claire said. Rodriguez was on his feet now, moving in the tight, controlled way of a person whose instinct was to act, and who was containing that instinct by force of professional discipline. Then we need to contact our command. Your command may already be compromised, Claire said. Rodriguez stopped. Walsh spent 8 months at DHS before this, Claire said. Before that, 3 years at a private contractor with deep penetration in domestic and military intelligence channels. I don't know how far his reach goes into your command structure. What I know is that the right move right now is not to make contact through any channel that Walsh might be monitoring. Then what is the right move? Rodriguez said. Right now, Claire said, the right move is to stay in this hospital, stay off your communication devices, and wait. Wait for what? Finn said. For me, Claire said. She pulled her sleeve back down, picked up Marcus's chart, made a notation that was entirely genuine and clinical, and looked at all 3 of them one final time. Nobody comes in or out of these bays without my knowledge, she said. If anyone identifying as federal or military attempts to access you, you tell them you're awaiting medical clearance, and you call the nurses' station immediately. You don't engage, you don't answer questions, and you don't confirm or deny anything about your operation tonight. She looked at Rodriguez specifically. Can you do that? Yes, Rodriguez said. His jaw was tight, but his eyes were clear. Good. She opened the bay door. I'll be back within the hour. She went to find Garrett. He was still in the supply corridor, which told her he was either very patient or very concerned. And with Garrett, those 2 things had always been difficult to distinguish. He looked at her face when she came in, and whatever he saw there made him straighten. Walsh didn't come alone tonight, Claire said. Collier was the front. Who came in through the service entrance with you? Garrett's expression shifted, fractionally. Nobody came in with me. Someone came in through the east service entrance at 147, Claire said. 6 minutes before you did. Different badge, also HVAC. She looked at him. Garrett. A pause that lasted 4 seconds. Her name is Vasquez, Garrett said. She's one of mine. She's been tracking Walsh's operation for the past 8 months. He stopped. Where is she now? Claire said. She was supposed to position in the east stairwell and hold, Garrett said. She's a watcher. She's not operational tonight. She's not in the east stairwell, Claire said. I checked every camera blind space in this building 40 minutes ago. She was not in any of them. Garrett's face did something she had not seen it do in all the years she had known him, which was show genuine alarm. Vasquez has been tracking Walsh for 8 months, Claire said. Tell me right now, Is it possible that the tracking went the other direction? The silence that followed was the specific silence of a person confronting a possibility they had refused to fully consider, and were now being forced to hold directly. "She has full knowledge of my location," Garrett said. His voice was very flat. "She is the only person outside of you who does." "Then Walsh knew before Collier walked in," Claire said. "He didn't come here because of the transport. He came here because Vasquez told him where I was. The transport tonight was coincidental." Or, she stopped, the next thought arriving with the particular cold clarity of a pattern completing itself. Or it wasn't coincidental, it was arranged. Garrett looked at her. "Jake's team was put in that geographic space tonight," Claire said, the words coming faster now, the architecture of it assembling in real time with the specific momentum of a truth that had been present all along and was only now becoming visible. Someone who knew I was in this hospital, who knew that a military transport from that region would come here, who wanted Jake's team in this hospital on the same night a federal agent came to assess me. She looked at Garrett. This was not two separate events. This was one event. Walsh put Jake's team in the field tonight, knowing they would end up here. He used them to create the context for Collier's visit, so that Collier's presence would look like a response to the transport rather than a targeted move against me. Garrett sat down on a supply crate, which was the most un-Garrett thing she had ever seen him do, and looked at the floor. "Vasquez," he said quietly. "Yes," Claire said. "She's been with me for 3 years," he said. "Walsh has been running her for at least 8 months," Claire said. "Possibly longer." She looked at him with the directness she had always brought to things that needed to be said clearly. "Garrett, I'm sorry." He was quiet for a long moment. He had the look of someone who had been in this particular place before. The place where a person you trusted resolved into something else, where the grief of it and the tactical reality of it arrived simultaneously and had to be carried at the same time. She knew that look because she had worn it. "If Vasquez told Walsh you were here," Garrett said, and his voice had become something careful and controlled, "and Walsh used the transport to create cover for Collier's visit, then Walsh has been planning this move for months. He is not doing reconnaissance. He has already decided what he wants to do. Collier's visit tonight was not assessment." "No," Claire said. "It was a message," Garrett said. "He was telling you that he knows where you are and he can reach you whenever he chooses." "Yes," Claire said, "which means the next move is not Collier coming back," Garrett said. "The next move is something harder. And it will involve Jake's team," Claire said, "because Walsh used them to get here, which means he has an operational interest in them now that goes beyond just closing a loose end. He will use them again, as leverage, as a secondary operation, as a way to get to me through people I've been treating tonight, which means people I have a reason to protect." Garrett looked at her. "You've been here 7 years," he said. "You know this ends the 7 years." "I know," she said. "You built something here," he said. "Not soft exactly, but the recognition of one person to another who understood what it cost to build something carefully over years and what it meant to see it become untenable." "I built something I was always going to have to leave," Claire said. "I knew that when I built it. I just didn't know when." She looked at the corridor, at the hospital around her, at 14 years of skill and 7 years of this particular life assembled into the ordinary shape of a woman with a badge and a set of scrubs. "Tonight, apparently," Garrett stood. "I have a vehicle. I have a route. I have 2 safe locations within 4 hours, one of which Walsh does not know and cannot know because it postdates anything Vasquez has access to." He looked at her. "But Claire, Jake's team." "I know," she said. She went back to Jake. He was sitting up when she came through the recovery unit doors. He should not have been sitting up. His post-op instructions were clear on that, but she had stopped being surprised by the ways in which he did not behave like a standard patient. He had his eyes on the door before she was through it, and his expression was the expression of someone who had been doing exactly what she had been doing, which was taking available information and assembling it into a picture, and who had just finished the assembly. "Walsh used my team," he said before she could speak. She stopped at his bedside. "How long have you been working on that?" "Since you left," he said. "The operation tonight, the location, the timing. It was too specific to be random and not specific enough to be a direct target. Someone put us in that space knowing what would happen." His jaw was tight. "My team was used as a vehicle to get to you." "Yes," Claire said. "Somebody in my command chain," he said. "I don't know how deep it goes," Claire said. "I know Walsh has reach into military intelligence channels. I don't know the specific pathway. What I know is that until we do, your command chain is not a safe contact." Jake looked at the ceiling with the expression of a man containing something enormous, and doing it through the specific discipline of someone for whom containing enormous things was a professional baseline. Then he looked at her. "What do you need from me?" he said, for the second time. But this time it was not an offer made in the rawness of new information. It was a deliberate, informed choice. She heard the difference. "I need you to let me make contact on your behalf through a channel that Walsh can't monitor," she said. "I have a name, someone in your world who is clean. I would stake my life on it, and I have staked lives on it before. I need to give them your team's situation and let them initiate a secure extraction for your men." "And you," Jake said, "I'll handle my own extraction." "That's not—" He stopped, restarted. "You've been handling your own everything for 7 years in a hospital. I think tonight qualifies as a situation where handling your own extraction is not the optimal plan." Despite everything, something moved through her that was not quite a smile, but held the warmth of one. "I have someone." "Is the someone reliable?" Jake said. "Mostly," she said. "Mostly," he repeated. "He has a good record," she said, "some notable exceptions. But tonight, I believe he's motivated." Jake looked at her for a long moment. "Give me the name," he said. "The clean contact in my chain. I'll make the call myself." "You're post-surgery," she said. "You're not supposed to—" "Claire." His voice was quiet and direct and carried the patient certainty of a man who had made his decision. "Give me the name." She gave him the name. She watched him take it in, process it, file it. He held out his hand, and it took her a moment to understand what he was asking for. She handed him her personal cell phone, not the hospital phone, because the hospital phone was on a network she no longer trusted. He dialed from memory. She watched him do it and registered, not for the first time, that he was exactly what the briefing had described. A person whose capabilities were genuine and specific, and not diminished by a chest full of shrapnel and a night of surgery. The call lasted 4 minutes. She heard one side of it. Jake gave the name of the contact, gave a code phrase that meant something to the person on the other end, gave a brief and precise summary of the situation. Team's location, situation with Walsh, compromised command channel, need for secure extraction. He did not embellish. He did not hedge. He gave the facts in the order they mattered, and he stopped talking when the facts were given. He handed the phone back. 2 hours, he said. Secure team will be here. My men will be extracted through a medical transfer protocol that Walsh won't be able to distinguish from a standard inter-facility transfer. Good, Claire said. Rodriguez is going to have questions, Jake said. Rodriguez always has questions, Claire said. Something crossed his face. The almost smile for the last time. It made it all the way this time, unhurried and real and entirely human. Then it faded, and he looked at her with something that held all the weight of the night without any of the edges. 7 years, he said, in this hospital, under a different name. You saved how many people in 7 years of trauma nursing? I didn't count, she said. I would have counted, he said. I know you would have, she said. That's one of the differences between us. He was quiet for a moment. The person who built this life, Clare Merritt, 14 years of trauma nursing, who knew your IV sites by feel and spotted a shifted fragment before imaging and talked Reyes through a physiology he'd never seen. That person was real, right? That wasn't just cover. She looked at him for a long moment. That was the most real thing I've been in a long time, she said, and she meant it with a precision and honesty that she did not bother to cushion, because it was 3:40 in the morning and he had earned the unguarded version. This job, these people, Maya and Patrice and Karen at the front desk, and Marcus in Bay 1 thinking about a horse drawing, this was real. Jake held her eyes. Then whoever she was, he said quietly, she mattered, whatever name she went by. Claire stood with that for a moment. Then she put her hand briefly on his arm. Not clinical, not procedural, just one person acknowledging another. And she stepped back. The secure team will come as a medical transfer unit, she said. When they arrive, go with them. Don't ask questions about the protocol until you're clear of this building. Make sure Rodriguez understands the same. He'll understand, Jake said. She walked to the door of the recovery unit. Colonel, Jake said. She stopped. The word landed on her in a way she had not expected, carrying the full weight of everything it meant, and everything it had cost, and everything that came after it, all of it arriving at once in the 3 syllables of a rank she had not heard spoken aloud in 7 years. She did not turn around. Thank you, Jake said, for my team, for all of it. She stood at the door for one breath. 2. You're welcome, she said. Take care of your people. She walked out. Garrett was waiting at the East Service exit with a jacket that was not her jacket, and a bag that was not her bag, and the particular calibrated readiness of a person who had done this before and understood that readiness was not urgency, that the difference between a clean exit and a blown one was usually the difference between moving with purpose and moving with panic. Claire stopped at the nurse's station first. Maya was there, end of a long shift, entering chart updates with the steady efficiency that Claire had watched her develop over 18 months and had been proud of, in the way she was proud of things she could not say she was proud of, because saying it would have required explaining why she cared so much. Maya looked up, read her face, set down her tablet. You're leaving, Maya said. My shift is ending, Claire said. That's not what I mean, Maya said, and you know it. Claire looked at her for a moment. Maya was 31, second-generation Dominican-American, born in Providence, Rhode Island, with a mother who was a retired school teacher and a brother who did marine biology, and the specific bright quality of someone who came from people who believed that showing up and doing the work was the most important thing a person could do. She was going to be a great charge nurse. She was going to be, eventually, a great nurse manager, and after that something larger, because she had the combination of skill and human intelligence that the work required at its highest levels. The patients in Bays 1 and 2, Claire said, and the patient in OR recovery, Bay 3. Watch for a medical transfer team coming in the next 2 hours. It'll look routine. Make sure it goes smoothly. Claire, and the chart updates for tonight, Claire said. Everything is in order. Reyes has the post-op files. The fragment removal was fully documented. She paused. You're ready for this. You've been ready. Maya looked at her with the expression of someone who was understanding something in real time and did not like all of what she was understanding. What's happening? The job, Claire said simply. The way it works sometimes. Maya's jaw tightened. Will I see you again? Claire looked at her. I don't know, she said, but I need you to know what you do here. Every shift. It matters. You matter. Don't let anyone tell you otherwise, and don't let anyone take your authority in this bay. You hold the room. You already know how. I watched you learn it. Maya's eyes were bright. She held them steady. Go, she said, quiet and fierce and final. Claire went. Garrett was at the exit. She took the jacket, the bag, 3 steps through the door, and into the cold pre-dawn of a parking structure that smelled like oil and concrete and the particular nothingness of 4 in the morning. She did not look back at the building. She did not need to. It was inside her, in the way all the real things were, the people, the years, the shift after shift of hands that did not shake, and eyes that read the room, and a job that had always been the same job. Different uniform, different name, same essential act. Keeping people alive, bringing them through. The car was a gray sedan, nondescript by design. Garrett got in the driver's side. Claire got in the passenger side. The bag on her lap held what Garrett's people had assembled as a go kit. Documentation, cash, a burner phone, and one change of clothes. Everything she had built over 7 years was not in the bag. It was behind her, in the building she was leaving. The badge, the locker, the night shift rhythm she had lived in for so long, it had become the rhythm of her own heartbeat. Garrett started the car. "Walsh is going to know within the hour," he said. "I know," Claire said. "He's going to move. He's going to try," Claire said. Garrett pulled out of the parking structure and onto the empty, pre-dawn street. The city around them was the particular still of a city not yet awake. Streetlights yellowing the wet pavement, everything held in the specific, suspended breath of the hours before the world resumed. "Where do we go?" Garrett said. Claire had her hand in the jacket pocket. Her fingers found the burner phone. And beneath it, something she had not put there. Something Garrett's people had placed in the kit. A folded piece of paper. She unfolded it. 6 words handwritten in a script she recognized immediately. "We need you back. It's time." She looked at the handwriting for a long moment. 7 years. 7 years since she had seen that script. 7 years since she had been the person those words were addressed to. Not Clare Merritt, 14 years of trauma, level 1 facility, night shift charge. The other person. The person who had a rank and a unit and 100% success rate and had spent 11 years in places that did not exist, doing things that were never written down. She folded the paper. "Drive," she said. Garrett drove. The city fell away behind them, and the highway opened up ahead, and Claire sat in the passenger seat, with her hands still, and her breathing even, and her face calm in the way it had been calm from the moment she first walked through the doors of Trauma Bay 3. The way it had been calm when a man seized her collar and slammed her into a wall and told her to get someone experienced. The way it had been calm through all of it. The shrapnel fragment, the surgical complication, the federal agent, the name that should have stayed buried, the tattoo, the 7 years, the life. She was calm because she had always been calm, not because the things she carried were not heavy. They were very heavy, and they had been heavy for a long time, and she was not done carrying them. She was calm because calm was not the absence of what she felt. It was what she had built around what she felt, over years and operations and loss, and the particular hard-won knowledge of a person who had learned that the mission did not stop, and the people did not stop needing someone who would show up and hold the room and keep them alive. The highway stretched out ahead of them into the dark. Colonel Sarah Christine Harlow, who had been for 7 years a trauma nurse named Clare Merritt, who had been for 11 years before that the most effective field commander of a unit that officially did not exist, straightened in her seat, looked at the road ahead, and decided what came next. She had always been the one who decided what came next. That had not changed. That would not change. Some people retired from the mission. Some people ran from it. Some people buried it under a new name in a civilian hospital and spent 7 years learning the difference between a life they had built and a life that had been waiting for them to come back. Claire had learned the difference tonight. The mission had found her in Trauma Bay 3, bloody and combative and contemptuous, demanding someone experienced. She had been in the room the whole time. She always had been.